enter who are in the waiting room. Yes, sir.
Shall I?
Sir, people are entering. Still, it is little bit delayed.
Yeah, only 4 are left. Sir, we can start.
Okay, okay. Good afternoon, all. Dear pharmacology colleagues, welcome to this platform of National Association of Pharmacology and Therapeutics. This is the concluding session of our competency-based medical education in pharmacology. And it has got a wonderful response. More than 380 registration we have got while we are expecting lesser than that. Thank you very much to all those who have supported us and those who have registered with this session of competency-based medical education. This is the initiative that have been started by the organizations to promote the medical education that is related to the pharmacology and therapeutics. Our all the series have received wonderful response, and we have successfully conducted all these workshops. This is the fourth series, and we are also successful. Before I can go ahead with this session, I would like to invite our chairperson, Dr. Geeta A., who is also member of National Medical Commission Board postgraduate guidelines, to speak few words on this occasion. Dr. Geeta A.
Thank you. Dear esteemed colleagues, good afternoon. Today we are concluding fourth online series. Let me use this opportunity to look back on our journey together. The enthusiasm, commitment, and passion demonstrated by each one of you have been truly inspiring. The relevance and urgency of CBME in modern pharmacology education have been the cornerstone of our discussions. Discussions, debates, and shared experiences during this workshop have highlighted the significance of holistic, outcome-oriented approach in reshaping the educational paradigm. The National Association of Pharmacology and Therapeutics has always strived to be at the forefront of educational innovation. Your active participation has ensured that this workshop stands as proof of our collective vision and commitment. I express my deepest gratitude to each one of you for contributing to the success of this workshop. It is collaborations like these that promise a brighter, more informed future of pharmacology education. Let us continue to work together, harnessing the power of CBME to create an environment where learner thrives and every patient benefits. Once again, I thank you for being an integral part of this transformative journey. I am confident that seeds sown during this workshop will bear the fruitful results in the times to come. Thank you.
Thank you, madam. And we are going ahead with the continuing of the session. I would like to introduce both the moderators for today's session. So the first moderator of today is Dr. Rangil Singh Raina. He is Principal Government Medical College Haridwar. He is a life member of the National Association of Pharmacology and Therapeutics. He is the member of the governing body of State Medical Council Uttarakhand, and he is former secretary of the Institutional Ethics Committee of Government Medical College Dehradun and Government Medical College Srinagar. He is also a former member of the Medical Education Unit of the Government Medical College Dehradun, and he has served as a former coordinator of the Adverse Drug Monitoring Center at both the college. He has been awarded as the best teacher of Government Doon Medical College Dehradun in the year 2017, and he is having more than 30 publications to his credit in various national and the international journals. as such, he is very having keen interest in the medical educations, and he will be moderating today's session 1 with Dr. Badial. The second moderator for today's sessions is Dr. Padamja Uday Kumar. She required no introduction probably. She is currently serving as professor and head department of pharmacology and also former vice dean at Father Murray Medical College, Mangalore. She is the president of our prestigious organizations, National Association of Pharmacology and Therapeutics, and during her first tenure as a first president, she has worked very hard and has helped the organization to reach the heights of the success. She has authored 25 textbooks in pharmacology. She is well-known authors in the pharmacology world. Everybody is aware of it, including 8 titles for medical, dental, nursing, physiotherapy, and pharmacy students, with 2 books based on competency-based medical education curriculum in pharmacology. She is having to her credit of the publication more than 56 research papers. She has also conducted and coordinated the several clinical trials and has served as a member of the board of the studies of the 2 universities, and she is the visiting professor of Anna Medical College, Mauritius. At present, she is the chairperson of the Internal Complaints Committee and Ethics Committee and Scientific Committee of the different medical colleges. For her achievements, she has been featured in an article that is titled "Erudite Woman Outstanding Contribution to the Medical Education." No doubt she is having a lot of contribution in the country in the field of the medical educations. We are well aware of. In the global journal of the magazine Medical Research, she has also been featured in the cover page of the magazine Mangalore Times. So with these words, I am handing over today's session to the first moderator of this session, Dr. Rangil Singh Raina.
Thank you very much, sir, for nice introduction. First of all, I am very much thankful to our society so that they have given me this opportunity. So before wasting the time, I'm just going for the introduction of our first speaker, Dr. Dinesh Kumar Badial, sir. So he is a vice principal, professor and head pharmacology, professor in the Department of Medical Education. He is also a program director, CMCL FEMER Regional Institute, convener of NMC Nodal Center. He is also national convener of our NMC ACME. He is a member of NMC National Curriculum Committee. So that's why today his talk is very important. He is very much involved with all this curriculum of the NMC also. He is also chairman of Scientific Research Committee, Mohanday Oswai Hospital, Ludhiana. He is editor-in-chief of our National Journal of Pharmacology and Therapeutics. He has contributed significantly to new competency-based UG and PG medical curriculum in India as a member of Reconciliation Board of the MCI or this expert group convener NMC. His area of interest includes the faculty training for the teaching, learning and assessment, clinical research, ethics, pharmacovigilance, development of low resource intensive simulation in the Southeast Asia and the competency-based curriculum. He is a faculty in the international and national medical education also, pharmacology and research programs. He has more than 150 papers and he has written research module for Open University of UK and authored 3 books and contributed chapters in others also. So we are very fortunate here that we have such a eminent and renowned this faculty, and he is going to discuss about our micro teaching. What are the methodology of micro teaching and what are the misnomers what we are facing in this micro teaching concept. So whatever during this talk, if you have any query, you can put on the chat box and we'll answer later on. So with this, I request Badial sir to please continue the talk, sir. Sir, please unmute, sir.
Thank you, Dr. Rangil, for the nice words. We'll start with the session now. So today we are discussing about planning a micro teaching session in pharmacology sciences, which goes beyond to many areas, as you can see. We'll keep it simple in the next 18 or 20 minutes just to save some time to understand the concept of micro teaching. So all of you are today here, and also to build up the steps to conduct micro teaching session in pharmacology. If you have seen the present curriculum, the CBME in the post-graduation MD pharmacology and other MDMS courses, which is applicable from 22 batch, you will see that the micro teaching term has been replaced with the assessment of teaching and presentation skills. On the other hand, we are discussing micro teaching today. Okay, so it has gone out of the assessment. So it means there was some issues, maybe the correct place of its use, which was not happening. So we'll discuss that also and the methodology. Before that, I would just like to see your responses. I don't know whether AI logistics is able to put it on the poll. If you are able to put it in the poll, you can start that. Otherwise, I will request participants to say Y or N in the chat. Are you aware of what is micro teaching? Let's see the responses in the chat. You can add.
It's mostly wise.
Yeah, we are getting many Ys.
Yes.
Yes. Okay. Yeah, we are getting Y. Okay, I got one N now. Okay, few more no's. Okay. So it means people are aware of that micro teaching is a term which is used. Have you ever been part of a session in micro teaching? Part on any side, presenter, or you're sitting there? Again, you can answer as Y or N. Okay. Yes, also few no's also. No, we are getting no's also here. Maybe 70% yes, 30% no. Something like that. Okay, so people are still responding to that. Okay, so if you have been part and you have seen what is micro teaching, have you ever asked for a session on micro teaching for yourself? For yourself, if you know why it is done, any yes or no here? Okay, we are getting no's, some yes, no's. Okay. Now no's are more. No's are more. Yeah, no's are more. See, it tells us which exactly I'm putting. You will see this wording coming in the next slide. We had many sessions on micro teaching. People were very enthusiastic. They know about what is teaching, but they don't use. One of the evidence for that is micro teaching has been dropped as a teaching from the faculty development program which are happening, including our regulators programs. Earlier it was there, now it is not there. So what is the reason? What is this happening? So in PG exam pharmacology, we know it has been a regular feature. Okay, so there will be some marks for micro teaching. And also, as I told you, faculty development, now they have dropped. No, this is happening frequently from 1960s. There are few takers after they learn about micro teaching concept and process. Why? That is something which need to try. That is something which you need to understand, and then we can probably improve its utility. So it was originally introduced for teachers in the making. That is for the pre-service training during their training for bachelor and masters in education around 1960s in the USA. After that, it has been used at multiple places. In the changing scenario, if you look at what is the meaning of the micro teaching is, the purpose is to provide a non-threatening environment to the teacher so as to practice and improve one's teaching skills which is very, very important, by receiving immediate and relevant feedback from colleagues on one's teaching skills. I'm repeating it again. This is very, very important. The purpose of micro teaching is to provide a non-threatening environment to the teacher so as to practice and improve one's teaching skills by receiving immediate and relevant feedback from colleagues on one's teaching skills. Non-threatening environment is very important. So it means what we say micro teaching in the final MD university examination should not be there, because final university examination is the most threatening environment. We have all gone through that. Okay, so that is that. So it is something which is invited by someone to improve, and immediate feedback is given. So as I told you, this has been very commonly used for assessing teaching skills. So educational tool has been used as an assessment tool, severely undermining its utility. Okay, that is the major issue. We must understand this is an educational tool. It's a teaching learning method and not an assessment tool per se for the summative assessment. Formative, we use it, but not for the university examinations. So then what is micro? Why we say, okay, we have so many teaching methods. Okay, why we are saying micro teaching? Okay, so it is a scaled down version of the teaching method. And micro means few predefined specific teaching skills. So today, okay, for example, if I want to improve my body language during a lecture, I will choose only one skill for one day. And I will invite few of my colleagues, a small group, 5 to 7. Small content. Okay, it may be 5 minutes content. It can be anything, any topic. Because the topic today which I has chosen is, for example, body language. It can be other things also. Overall small duration, 7 to 10 minutes. Okay, so that is small in micro. So everything is micro. And otherwise, if you see, even with these connotations and combinations, various forms of micro teaching have been described. But even people know this is a micro. There are myths and lack of awareness about the term as well as methodology of micro teaching. This was felt by the originator also. They found that micro teaching people are not using. So they revised it to 21st century micro teaching, version 2. It was around 1996. But still, as I told you, people were not picking up. We were having a one session of 1 to 2 hours in the basic courses, which has been dropped now. So we studied it extensively, worked with many groups worldwide, and we came with version 3 on the micro teaching, because there were issues with the checklist, with the pendant model. For example, with the checklist, if you know, pharmacology now have many communication skills. For example, if you are doing a consult on the HIV medications or tuberculosis, these checklist has a word, use of laughter. Laughter is not, you can use anywhere these days, everywhere. Okay, breaking a bad news, consult on HIV medications. But since it is in a checklist, you have to take yes or no. Okay, so that was affecting all those components of feedback given. When pendental room came, okay, where you ask only what went well, how it can be improved. Okay, so micro teaching version 3, which we actually proposed in 2018, keeping into all the issues which are preventing people to use it. We'll come to those also. So as of now, micro teaching, if done in a proper way, gels in the CBME for MD pharmacology, where we see MD pharmacology students need to become teachers, but they are not taught like that. So this is one methodology we can use to improve their teaching skills. And you will say, why I'm talking about PG students? Why not faculty? Earlier level, mid-level. So that is a question for all of us. Because we have seen today, the answer was no. We do not want micro teaching for ourselves. We want it to implement on others. Okay, that is not the actually for micro teaching is if I feel, okay, today I'm left behind in the social media. I want to know more about Instagram, use of that social media in my live lectures. Maybe I can ask some of my junior colleagues to sit down with me. Okay, I will give 5 minutes of presentation using those media and ask them how I can improve onto that. Okay, so it's invited. The only thing is you have to identify which skill you want to improve. So MD Pharmacology curriculum, now it's very well written that micro-teaching word is not there in the assessment. So it is assessment of teaching. What we do on that day, most of us has experienced that as a student or as an examiner, the micro-teaching part, where some student will come, they will present. And usually what I have seen is the questions asked are not on the teaching skills, okay, but on the definition, on the topic, on the pharmacology of a drug, then it means we are deviating away from that. So better to name that session as assessment of teaching and not micro teaching. Micro teaching is a part of methods, teaching methods, not assessment. So you can add it into a teaching method and remove from the summative university assessment. Many universities have removed. We have talked during extensively with the board of studies with many universities around on this. Let's go to see how micro teaching sessions you can conduct in the pharmacology sciences. Teacher, when I say teacher, it means postgraduates whom we give teaching experience of 3 years, they are also included. Remember, they are supposed to take classes equally. Okay, so they also need to be trained equally. Like these days, teachers are trained in basic courses. So they should also be trained in 1 or 2 days programs. So this teacher invites few of the peers, 4 to 5, from same or other departments, from whom he is very comfortable and open for suggestions at a place and time suitable to us. So ask 4 or 5 of them, can we meet for 10 minutes or so? Welcome all and inform skill component she or he wishes to practice on that day. As I told you, body language, use of interactivity, only one you will choose for it 1 day. You might be wondering these skills. So I'm talking about interactivity, gaining attention, questioning, presentation, reinforcement, audio-visual aids, closure, voice modulation, any of the skills you think you need to improve, you invite a micro teaching session for that. So coming back to that, so after that, one of the peers sets a video recording for the session. Use simpler things like mobile. The presenter presents for the 5 to 7 minutes. Video is handed over to presenter. So probably you take their mobile phone only, his or her. Give 5 minutes to review in another room. So you send the presenter to another room that just watch your video for 5 minutes and please come back after that. In these 5 minutes, peers discuss what was good, how it can be improved. They make a list, agreed upon points. Presenter comes back, peers representative. Remember, it's not one-to-one feedback. Peers representative, you have chosen one, provides feedback. So it's anonymous. So if the people are from the same department, the issue which has been happening in micro teaching, okay, so that will not be there. So peer representative asks, first applies by the presenter, then the peer representative adds to that, which has come from the peers group. So what they ask? They ask, please tell what you think went well in your presentation. This is the first question. Once a presenter replies, peer representative adds on what has come from the group. So he's now presenting his view, remember, group's view. So he doesn't become very defensive. He is not so passionate about what they are telling. And then after the second round starts, please tell what changes you will do if you have to take this session again, or what can be made better. Accordingly, the peer representative adds on to that. So this is a cycle based on Pendental's rule. Okay, so this way, we don't advise these days use of feedback sandwich. There has been some issues to that. So individual feedback is not there. This is anonymous, less threatening. Interpersonal relationships are not affected since only representative is conveying the feedback of the group. So after that, replan and reteach is left optional to the presenter. Okay? Sometimes they need time to replan. Then sometimes if it is on the body language, they want to do there only. So they can replan and reteach there only, same day or other day convenient to all. But remember, sufficient time should be given to the presenter to practice and feel confident about the next presentation. So this is the complete micro teaching cycle which happens. And it's important to understand this process that by video review, you add on to this anonymity part, which is there. Similarly, they have a self-review of this. But we have seen that with the even micro teaching newer versions, checklist issue is taken care of. There's a self-review time to the presenter, which makes him more aware. When you see yourself in the mirror, you will realize that there are a lot of feedback which you get non-verbal. Individual impulses are moderated from the peers. As agreed feedback of peer group removes the tag of fault finding, which happens many times in the so-called micro-teaching sessions. So it means when group feedback is given in a constructive way, it is easy to be accepted by the receiver. And peers also are not worried about because they are not giving the one-to-one feedback. Their name is not coming. So they can provide honest feedback without the fear of any damage to their relationships with the presenter. This was one hindrance found out in the micro-teaching sessions. The peers representative does not become too defensive about feedback because he doesn't say it is his feedback or her, but of group's feedback. Okay, so these are definitely advantages on which actually there can be a good discussion when you know it's anonymous and it's from a group. So a lot of challenges are there which you can convert into opportunities. Use the newer version and see what happens. But remember, you have to convert this into a teaching learning method, not assessment method. So you are learning in the PG courses in pharmacology. You can make it a part of your routine scheduling, and also how to establish this non-threatening environment during that. This is very, very important. Only then people will be asking feedback on their presentations more and more. So as we come to the end, micro teaching, pharmacology teaching can add a useful component. We need to learn how to create non-threatening and anonymous scenarios. This is very, very important. One of the issue which we faced at many places when we go for the examination where the so-called micro teaching is there is, it's very threatening. No anonymity is maintained. Okay. And later on, when you go out of this room, okay, sometimes you feel this was not such a healthy discussion which happened there. And it happened one-to-one, and sometimes it affects the relationship. And since micro teaching, we expect to be adopted as a teaching learning method, where you have some of the colleagues you are very comfortable. They might be from your department, some adjacent departments. So relationships are also very, very important here. So if you add on anonymity part to the feedback, that will take care of that. So coming to micro teaching in pharmacology, all the postgraduate courses, definitely, it has to be a part of the teaching learning method. There's a flexibility in using this method. So remember that you don't need any permissions or regulatory permissions for that. You can straightway go ahead for that. And in assessment, remember, don't use the term micro teaching. It is assessment of teaching skills. Micro teaching is to improve the teaching skills. Later on, what is the impact of that? Then you can put into the assessment how to assess these teaching skills. That way, it will go and align well with the curriculum. And Dr. Angil, we will like to take more questions. I was keeping some time for that.
Okay, sir. Okay, thank you very much, sir, for your this crisp and concise informative lecture, sir. So we have one question from sir, Dr. Chitra, that in few MD syllabi, instead of micro teaching, the word used in pedagogy, is it correct, sir?
No. Pedagogy is a much larger, wider aspect of that, as we most know about that. So they are not interchangeable as such. Pedagogy will cover many teaching learning methods. So Dr. Payal has asked about types of micro teaching.
Types of MT, different parts of it.
Yeah. So types is micro teaching is one type only that we are using it to improve the teaching skills. Different components and part we have explained that in this slide. So these are the different components or part of that. Dr. Rajkumar, duration of micro teaching, including discussion, It can go up to 20 minutes. The presenter part, when they are presenting, is 5 to 7 minutes.
There's one question for me also, sir. Can we just in the micro teaching, if suppose PG are doing this micro teaching, can they involve the teacher also there, or it would be more beneficial if only PG are there?
No. Like suppose there's a one PGA.
Yes, sir.
He feels very comfortable with the one professor, one assistant professor, one PG, and one SR. So these 4 can be the people sitting there on that day.
Okay. Another question from Dr. Cecily there. In micro teaching only for teacher to improve skill or student also?
For PG students, definitely it is a method to improve their teaching skills. Teachers should use more to improve on earlier whatever they know, to improve on more of the skills on that. So both can use it.
Okay, thank you, sir.
Maybe
Is
like
there any term like mini lecture?
Mini lecture to Dr. Hitesh, we all are so expert, we start mini lecture everywhere. Even sometimes we see in the question answer, a mini lecture starts. So that is usually a one-way type of thing.
Okay, sir.
So
no more questions, sir?
Yeah.
So
is there any hand raised?
No, sir. I could not get any.
Okay. So anybody has a burning desire for a last question, you can raise your hand. We will unmute you. Okay. Otherwise, I think we have saved a good time and we can go for the next one.
Sure, sir. I think no more questions, sir. So thank you very much, sir. So we have really very informative, excellent lecture, sir, where we have first thing that's important from this I got is it's non-threatening environment should be there in micro teaching. Similarly, it should not be an assessment tool that we are using in the PG. It should be a learning technique. And here another important point, predefined specific teaching skill. That's very important. Stepwise, we can improve our different skills. And you have well explained the different steps so that we can implement all these things in our departments also. So, and how to get the feedback. That's again very important that that part should be well defined and how to do all these things. So with this, I just thanks once again for very informative, very excellent lecture from our Vidyal sir. Thank you very much, sir. Dr. Kamal?
Yeah, we can start the second session. I would like to invite the second moderator for today's session to invite her for starting the session.
Thank you.
Good afternoon, everyone. Can you hear me? Am I audible?
Yeah, you are quite audible. Thank you.
Thank you for the opportunity. It's my pleasure to introduce Dr. C.M. Kamal. As he himself said, he requires no introduction. We know him for so many years now. And anyway, for official introduction purpose, Professor of Pharmacology and Head of the Department at Government Medical College, Saranpur, UP. He and PG Assessor at MC New Delhi. He is certified GCP certified trainer in medical education as well as UG and PG teacher. His professional experience of 15 years, academic experience in pharmacology, and 18 years of clinical experience in as a pediatrician. He has worked in CRO as a clinical research physician. He is the founder of National MD Pharmacology Movement. And that is why we are all here today. And he is responsible for creating a single platform of MD pharmacology. Not only that, he is the founder, national coordinator of NPT. He is the founder of NPT also. He is the former director and founder, Department of Clinical Research, Sharda University Hospital, Greater Noida. He is author of a book, Drug Therapy in Pediatrics, represented country at International Pediatrics Pharmacology Symposium organized by IUP-HAR. So it was a great pleasure interviewing Dr. Kamal. And over to Dr. Kamal. His talk on use of media in pharmacology medical education. Thank you.
Thank you, madam. My slides are visible.
Yes.
Voice is audible.
Yes, very much.
Yeah, thank you. Thank you very much for your kind introduction. My sessions or discussion of today's is the media in medical education. We will be focusing more points that are related to our specialty, that is the pharmacology and therapeutics. So, as told by the George Corius, technology will never replace, because some of our senior or some junior colleagues also are having some confusion related to the technology, especially some senior colleagues, that technology may replace the great teacher, but it is not true. Technology will never replace great teachers, but in the hands of the great teachers, it's transformational. So in this presentation, I will be enumerating some of the most widely used media to facilitate the medical educations, and I will be describing the Mayer's cognitive theory of the multimedia learning, because the Mayer's is the first person who has described this cognitive theory of the multimedia learning and its principle in medical education. I will be discussing some aspect of the computer-assisted learning, and will be focusing on its disadvantages and some of the limitations that are associated with the computer-assisted learning. We will be discussing basic principles of creating and delivering the good PowerPoint slides presentation, because most of us as a medical teachers are using the PowerPoints, and it is an integral part of the media in the medical educations. Then we will be having some discussion on the use of the smartphones and the social media in medical education, a discussion on the current trends, challenges, and the barriers that are associated with it. Familiarize with the salient features of the web-based learning, including the internet, understanding the use of artificial intelligence. Very briefly, I will go through it. So discussion may be little bit lengthy, but I will try to stick to the time that have been allotted to me. So what is multimedia? So multimedia refers to the computer-assisted integration of the text, the various drawings, stills, and the moving images that are videos, graphics, audios, animations, or any other part of the media in which any type of the information that can be expressed, that information can be stored, or that information or that graphics, or including all the things, including the drawing and text, can be communicated or can be processed digitally. So this is the basic definitions, and as such, these are the major components of the multimedia. Multimedia, as we all know, is consisting of the various components. Here I am showing you the list of the major component, that is text. We are already aware. Graphics are integral part, animations, some videos, and associated audios we can play with the multimedia presentation. So it is the Mayer's, who is the first person. Richard Mayer's has been at the University of California. He was the first person, along with the Monod, who has for the first time defined the cognitive theory of the multimedia learning. That is stating that is deeper learning can occur when the information is processed in the both text form and graphic rather than the text alone. So the theory of the multimedia learning hinges on the presumption that there are the two channels of the learning. And if we are using both the channels, here I'm showing in the diagrams also that if along with the spoken words or the printed words, we are showing the pictures or graphics, then our input channels that is going through the ears and eyes are also processing it. It is going into the working memory in the after the phonetic processing and the visual processing. So if we are using both the channels, that is the auditory channels along with the visual channels, it is much more effective as compared to the single channels that is possible without the multimedia. So in the what we are doing in the multimedia, we are using the dual channels, channels that are related to the auditory and that is related to the visuals. So it is much more effective. And here I'm in this diagram, I'm showing how these two channels are being used and how Richard Mayers have described his cognitive theory of the multimedia learning. So as you can see from here that in the multimedia presentations, we are using dual channels, words along with the pictures, graphics. Then it is going to the sensory memory. We are listening it through the ears. We are having a look on through the eyes. Then some of the selected words and along with the selected images that are presented to us as a new information, it is going to the working memory of the brain. Here I am discussing the basic aspect of how we are storing our through our brains the new information which is delivered to us for the first time. So it is going into the working memory. Brain is organizing words and it is organizing images also. So there are verbal modes and pictorial modes. And what the brain is doing, brain is trying to integrate this newer information with the prior knowledge. And after integration of it, you can see from the diagram over here that it is going to the long-term memory. So from the long-term memory, we can recall it later on. So this is how the multimedia is much more effective because it is using the multiple channels. And here in this slide, I'm showing you the goals of the introducing computers into the education, specifically to the medical education, to keep the education system at the forefront of the technological development and student skills up to the date, and with those that are expected with the students at their workforce, at their working place. And it enables more self-directed learning with the students as an active learners, which can be assisted by the teachers to construct their own understanding. So with the visual powers of the simulations that are available with the help of the computer, it can generate images and which can help the students why are the things are in the way where they are. So by using computers in the form of the instructions, that information can be displayed quite effectively, which enables our medical students to understand the concepts quite easily. So this is in the diagram, this is the image where I'm showing you the a lab where the students, medical students are working on the desktop. This is the computer assisted learning, how it is looking like. Computer assisted learning is a type of the education that is using the use of the computers. And of course, this is having the Wi-Fi connections in all the computers. So it is a well-established lab and it has become very, very popular and has drastically altered the academic environment and the various achievements by the medical students. We are that is quite evident all around our environment in the medical institutions also. So the computer assisted educations enables learners to learn from a combination of the technology and of course the content that are having with the this computer assisted education. So this is likely to ensure much more interactive learning experience to the students and contributing to the overall success of various learning strategies that we are devising for the students in the medical education itself. So recently, National Medical Commissions have also given some guidelines and almost most of the medical institutions nowadays are having the computer assisted labs and though the numbers that have been prescribed should increase, in my understanding, there should be much more computers available to the students to be having a good utilization of the computer assisted labs. So I need to convey one important information, that while we are discussing the computer assisted learning, the thing should be hammered in your mind. Please remember that the computer assisted learning is not synonymous with the animal experimentations. At the platform of National Association of Pharmacology and Therapeutics, we have also conveyed this information various times, that CALS should not be considered as a synonymous with the animal experimentations. There are various kind of the other experiments, other activities that we can also do with the help of the computer assisted learning. So computer assisted learning having the advantages that it reduces the workload of the teachings, it improves the motivations among the students, and it can help to reach the information to the larger audience as compared to our conventional methods, because there are multiple dimensional learning, and it is promoting the interactive learning among the students. Students are becoming more interactive through the computer assisted learning. They can build a lot of confidence among the students, and it is helpful in providing the immediate feedback. One example of the feedback you have seen during the sessions of my senior colleague, Dr. Badial, sir, where you have given the immediate feedback, where a poll has been conducted in today's sessions. So it is a method, and it is an excellent method of providing the immediate feedback, even while we are sitting at the comfort of our home. So, but there are certain kind of the disadvantages also that are associated with the computer assisted learning. The most important disadvantage is that it is labor intensive, and it requires a lot of appropriate hardware backup. It requires the frequent kind of the upgrading, and in addition, there might be needing a dedicated information technology staff. We need to hire a technology staff, and that is integral part of that computer assisted learning, which is very much essential to provide practical advice and maintenance of the various software that are running on the various computers. It requires dedicated Wi-Fi connections and high-speed internet. And some people may be less inclined to use of the electronic resources, but as of nowadays, most of the students, including the medical teachers, as has been revealed by the various studies, almost each and every medical teachers, or among the students also, there is 100% use of the smartphones. So in some or another ways, students are quite familiar with these new methods. And these are the latest current recommendations. These have been recommended by the National Medical Commission, New Delhi, in relation to the computer assisted learning. Again, I have provided the link that are related to these various activities. So I want to convey the message that is loud and clear, is that apart from the animal experimentation, the computer assisted lab should also be directed for the various other activities. Say, for example, searching of the national list of the essential medicine. I have provided the link of all the data related with it. List of approved drugs, banned drugs in the India. We need to make our students aware of the price control drug list through the computer use, and pharmacovigilance program, ADR forms that are available. And most of the medical institutions are also reporting the adverse drug reaction through the use of the computers and the internet. And antibiotic stewardship program, hospital formulary, standard treatment guidelines. We can allow our students to practice on the computer in the computer assisted lab on the various components related. Then I will be discussing some aspect of the PowerPoint presentation, because as a medical teachers and most of our medical students are using this method, PowerPoint, for the medical educations in our departments. So I will be discussing some of the tips that are associated of making good PowerPoint slides. We can start the pharmacology lectures as I am showing you here with the case or some story presentation, which is making it very, very interesting. So before, if I am taking the class of the anti-epileptic drugs, I will be narrating a real life story that how I have encountered a patient which have developed the status epilepticus or some another chapters related to the cardiac drugs, how a patient have developed the cardiac arrest while traveling. And I will be then defining this through this story. I will be trying to generate some interest among the students and before the start of my class. It is very, very important that speaking through memory is very, very important while we are taking the classes or through the PowerPoint presentation. We should always remember that our slides are only there to support us and it need not to replace our talk. So all the time we must remember it that if I want to tell you a story, describe my data, explain circumstances, there should be only keywords that should be available on the slides. It need not to be that the entire story should be printed in the form of the text and these students are learning. So our PowerPoint presentation should not be converted into a reading wall that where the text is written already there and students are just very quickly going through, they are reading it. So as such, the making of the good slides of the PowerPoint, it is a fine art for building and exhibiting a compelling presentations that can keep the audience attention all the times. And the biggest rookie that I already explained related to the PowerPoint presentation is the mistake to copy and paste all of your information verbatim on the slides. This is not only incredibly boring, but maybe no one is going to have the time or that kind of the inclination to read the wall of the text. So we should avoid these things should be kept in our minds when we are making. Using the backgrounds, appropriate backgrounds are very, very important. Background can be fun, but they can be sometimes distracting. Sometimes you cannot read the text. Sometimes they are much more interesting than the data. The best contrast that is I would like to recommend through this presentation is the black or white, as I'm showing over here. So you can see over here that this is the example of the bad background. We should avoid bad background that are distracting or finding difficult to read from the background. This animation is also not necessary to be associated with the presentation. Again, you can see that the background itself is quite distracting, and where the background itself is find to be much more interesting as compared to the words that are written. Again, this is also not a good example of the background where the fireworks, more of the attention is going to the fireworks than the text that are written. So I can say that this is the example of the good background, a clean background, where white background, where the black words have been used. It is quite impressive also, and it is showing a lot of energy in the presentation. We can use the dark background also, like this example. It is also can be taken. Usually my preference is for the white background, but we can use a dark background as I have given in this examples. Again, this is also a clean slide where on the top of it, I have written the heading that is related. We should also pay attention to the use of the colors, because the colors show emphasis, but it should be not be used the various colors. Say for example, red text cannot be used on blue background, or you can see vice versa. That blue text, it is very difficult to read against the red background. And there are the certain colors that should be avoided, that are purple, pink, or bright greens. It is yellow that can be used on the black, but you will find yellow color very difficult to read on the white background. You should also remember it that the color that are looking very good on your computer screen may not be readable at all on when you are projecting it through the projector screen. Here on the left, I have shown an example that this is the image that is when you are looking at your computer screen, and on the right side, you can see that it is not that kind of the image that you have prepared on your computer. So you should also keep in your mind that the projector image can be little bit different from your computer generated image that you are preparing through the PowerPoint presentation. Again, this is an example of the good slide. Animations may be used, and because of the time constraint, I will be quickly going through my slide. This is unnecessarily not needed. This is an example of the bad graphs as compared to that. This is the clean graph you can see over here, and it is much more attractive, much more emphasis has been given. So usually people ask how many slides should be there. The rule of the thumb is that we should use 1 or 2 slides per minute, including the opening and closing slides. We should spend much more longer, because some of our slides may require longer time as compared to the other slides. So I would like to suggest if we are having a 12 to 15 minutes talk, we should prepare 12 or 15 slides. It may be maximum up to 20. We should also choose very carefully the various fonts. There are the two kinds of the fonts, that is serif fonts and the sans serif. So as compared to the sans serif font, if we are looking at the slides over here, serif fonts are having a little bit thick and thin strokes, and there are little bit tail ends that are associated with it. It is difficult to read on the slides, and while the sans serif fonts are quite easily be readable, and it should be preferable in using the making PowerPoint slides. We can use bullets, and number of the bullets. We can use the 6 and 6 into 6 formula for preparing our PowerPoint presentations, so that there should be 6 lines in one slide, 6 words in one line, and it should be readable, having readable in the laptop, and it should be readable from 6 feet. So that is the one concept in the one slide. We should try to put one concept in a single slide. So the key messages that are associated with the PowerPoint, we should use a simple dark background or with the light letters, or white background with dark letters. We should use uniform colors and font scheme throughout the presentations. We should prefer sans serif type of the fonts. Examples are the Arial, Helvetica, or Tahoma. We should use font size that should be large enough to be seen from the back of the room where we are actually making presentations. And we can again follow the formula of 6 into 6 into 6. We should always have a backup plan, that if something goes wrong, we should be having copies of the presentations or handouts that if even without the PowerPoint, we should be able to carry forward. We should all follow the etiquette for the acknowledgement. Yesterday also some senior teacher is also having some discussion that if we are using the slides of somebody else, we should having the etiquette at least for the to convey the acknowledgement. We should always acknowledge the source person, or the person to whom we are using the slides or material of somebody else. And if we are using the copyrighted materials, we should follow the various guidelines that are associated with the copyrighted materials. So there are the various tips to enhance the PowerPoint presentation. I will not be going into the details because of the time constraint. I can just tell you that an image can speak for the thousands of the words. So in this slide, I have shown the adverse effect of the corticosteroid. So in a single slide, it is able to convey the adverse effect of the corticosteroids in much more effective way, rather than if I just will be putting only text letter associated in the slides. So we should try to use more and more images, because images are kept for a long period, duration of the period. Here I am showing a video demonstration, and we should already check beforehand that whether our video is playing or not. Like this example, that the video is not playing. Here I am showing the video.
Project 9, how to give an intramuscular injection. Medication is injected well into the muscle layer below the various layers of skin. You will need a clean work surface cover, an alcohol wipe, a pair of clean gloves, a vial of medication, a 5 cc syringe, 2 18 to 20 gauge needles, one should be a safety needle, cotton wool or gauze, an adhesive bandage strip. Follow these steps. Greet and positively check the patient's identity. Check the following on the medication ampule or vial before proceeding: the correct name, volume, and concentration of the medication, the expiration date, abnormalities regarding consistency and color of the medication in the vial. Draw up the medication for intramuscular injection as described in Project 6A. Prepare your hands hygienically and don clean gloves. Choose the injection site for the dose and expose the area. There are several areas of the body suitable for giving intramuscular injections: deltoid muscle, vastus lateralis muscle, ventral gluteus muscle, dorsal gluteus muscle. Wipe the injection site with an alcohol pad for 30 seconds in an outward circular motion up to 5 centimeters around. Allow the site to air dry for 30 seconds. Open the index finger and thumb of the non-dominant hand about 2 inches or 5 centimeters. Place them on either side of the planned injection spot and then gently spread finger and thumb to tense the tissue. Ask the patient to relax and take a deep breath. As he or she inhales, insert the needle at a 90-degree angle in a quick, dart-like motion to an appropriate depth and ensure that the needle tip enters the muscle properly. It is essential to aspirate before depositing the medication into the muscle. To do this, gently withdraw the plunger before the injection in order to avoid an inadvertent intravascular injection and thus a possible medical emergency. If you aspirate blood, withdraw the needle and prepare a new syringe. If no blood is aspirated, you can inject the medicine as follows. Continue to hold the skin and push the syringe plunger while slowly counting from 1 to 10.
These kind of the various videos, we can make our presentation much more interesting.
Project
demonstrated over here. And here, very quickly, I'm showing complete video, but this is just an example of.
Before going into the macrolides topic, let's first discuss about protein synthesis in bacteria.
Macrolide drugs.
Bacterial protein synthesis.
And it is much more.
For bacteria to survive, it requires protein for reproduction, growth, repair, and regulation of metabolism, which are coded by unique generic code present in DNA. There are 2 main steps in bacterial protein synthesis: transcription and translation. First, let's talk about transcription. For the bacteria to begin protein synthesis, the double-stranded DNA molecule must unwind and separate in the region which codes for the specific protein.
The various mechanisms
Only one strand of DNA serves as a template.
with the
Transcription is carried out by RNA polymerase, which results in the formation of messenger RNA, which is an exact.
So then there are a lot of use of the smartphones and the social media and the medical educations, and there are the various kind of the social media popular tools that are available to us. We are very actively using WhatsApp as an important a tool for the spreading of the various kind of the informations, and lot of information can also be shared through WhatsApp. Various kind of the important videos can also be downloaded from the YouTube, and we can search lot many images through the Googles. Well, lot many information, plethora of information is available on the Wikipedia, freely available to each and everybody. So there is increasing use of the social media nowadays that are associated with the medical educations. We are having various kind of the medical apps that are available to us, and medical residents in the various medical institutions are using these medical apps very frequently nowadays. So the time has now come that we should try to integrate all these practical things which our students are already using when they are going to their practical life into the curriculum itself, and we should train. And this is the Jan Aushadhi Sugam app that have been launched by our Honorable Prime Minister Narendra Modi ji, and most of the journals are nowadays are available online. We cannot deny that they are playing an important role, and most of the journals are having print and electronic media in the form of the HTML or PDF files. A personal library subscription can give access to both. Then a lot of use is also the artificial intelligence is also giving a lot of playing an important role in the medical educations. ChatGPT, I'm using the paid version of the ChatGPT, and where I'm showing just in this slides, I have asked a query to the artificial intelligence ChatGPT yesterday that please create a clinical case study that I can use before teaching anti-anginal medications. So it has beautifully written a case study for me, and it can save a lot of time and others my efforts also. So in summary, that I'm concluding my presentation over here is that applying multimedia principles enhance the learning in medical educations. Multimedia is required in medical education to keep the medical system at the forefront of technological development. Multimedia help students to enhance a skill up to the date and those expected in their real workforce. So multimedia promotes self-directed learning with the students. We cannot deny the importance of it with the students, that many students can learn through use of the multimedia through self-directed learning. As an active learners assisted by the teachers to construct their own understanding. And with the use of the computers in instructions, information can be displayed effectively, which enables students to understand the concept easily. These are the certain of the acknowledgements to my senior colleagues and other peoples who have been in my constant touch, and they have helped a lot. I would like to convey my sincere gratitude to all of them, and I have used the video of the apprentice doctor's medical simulation training from the YouTube. I just wanted to acknowledge that also. So with these words, I'm concluding here. Thank you for giving me this opportunity for speaking. Thank you.
So that was excellent presentation. There were so many practical tips, particularly for those who are starting, those who are juniors, they are starting their teaching career. It is excellent presentation, Dr. Kamal. There are just one or two messages here. One is, sir, kindly arrange CME on how to use AI for pharmacology research. You were telling about some AI.
Yeah, madam, this was yesterday also several of the postgraduate students have sent me the message directly, and I am happy to announce from this platform that under the guidance of our President and the learned General Secretary, that we are organizing the conference, national conference at Lucknow, and we are holding a separate workshop that is entirely dedicated to the use of the artificial intelligence, and we are giving training. And I would like to convey that we would like to organize several of these kind of the session in the future also.
Thank you. Can abdomen be the site for intramuscular injection is the next one.
Abdomen. Abdomen is the preferable site for the subcutaneous injections we are already using. And it is the muscular site like for a lateral part of the deltoid and the deltoid muscles and the other muscles, the larger muscles of the body where intramuscular injections are preferred. Because we need to ensure that the needle during the intramuscular journey should always be in the muscle itself. It should not go to the vessels. It should avoid vessels.
One more use is to get feedback from the students. To get feedback from the students, one more use. I think he refers to the use of technology in this.
Yes, yes.
So thank you for discussing how we can use AI in our presentations. And
there are not many queries related to the AI, and we are promising from our supporters and pharmacology colleagues that we are giving a lot of attention. We are also paying attention. We are also in learning phase because it is a developing newer technology. It has not developed fully. It is in the development stages, and where on the daily basis there are many updates are going on. And there are little bit differences in the paid versions and the free versions also. I would like to suggest paid version is better as compared to the free version.
Yes. So I think there are no more questions except some appreciation that very nice presentation. Both talks were good and all that.
I would like to convey also that we can continue the various kind of the questions and various another queries through our WhatsApp group also, because I have overshooted my time. I feel sorry for that. And we can continue the discussion in WhatsApp group also.
So thank you very much. Both were excellent talks, and it was the entire the series of sessions on a personal note for me was very, very useful and very interesting. And I thank all the participants, thank all the resource persons for their enthusiastic, there's a lot of preparation required to come and present in such a forum. So I really thank the resource persons for their efforts. Thank you one and all.
Again, through this platform, I would like to pay my sincere gratitude to all our supporters, our President, Dr. Padamja Uday, General Secretary, Dr. R.K. Dixit sir, speakers of today's session, Dr. Badial sir and Dr. Rangil sir, for moderating beautifully the first session. And we are thankful to our supporters because this platform is exclusively meant for the MD pharmacology specialty. So we are eagerly waiting to meet you all there in our conference, national conference that is being organized at Lucknow. Thank you all. With these words, we are concluding the session. Thank you very much.
Thank you. Thank you.